in any surgery, that surgery is always performed in the mind first, and then we execute it on the table, on the operation table, like we say. So the human body is very complicated.
Yeah.
It is not like you take a screw out of a machine and you fix it. It's not like that. So every body is different. So once we go inside and we know how the things are, we have already performed that surgery in our mind. There should be something that keeps you grounded. So that God complex has to go. So at a point in time, yes, when you are successful, you are a good surgeon. So there should be something that holds you back also. So in surgery, we say good surgeon always knows when not to perform a surgery or when not to operate. The basic things being hurry, worry and curry. Definitely the cancer is on a rise because of all the changes that those have happened in the last maybe 2 decades, but the diagnosis has also improved. There has to be something inside of the attitude of the patient. The treatment that is received by everybody, but when you are mentally strong, it definitely helps. That is where spirituality also comes in. Any good doctor will first try and be positive with the patient. So those positive vibes are very, very important. The patient coming in agony and the doctor just criticizing, "Arey, ye kya ho gaya tumko? Aise kaise chalega?" Is not the way. He's already in distress, so you need to calm him down. You need to give him a good hope and positive vibes.
How much would you believe in a conspiracy theory that it's in the interest of the whole healthcare system to not have a cure go out as quickly as now? Welcome to today's episode of 42 Talks, where we get an answer to everything. Today we have with us Dr. Mihir Chitale. Now, Mihir is a young surgeon at the cutting edge of medical science. He's trained in the minimally invasive robotic surgeries and has made some groundbreaking life-saving efforts over the past few years. Today, Mihir will talk with us about the mindset of a surgeon, what makes a good surgeon, his beliefs about treating people towards better health, and also what a positive mindset means. Please welcome Dr. Mihir Chitale on today's episode of 42 Talks. So welcome Dr. Mihir Chitale to this lovely podcast that we call 42 Talks. The
Thank
answer
you.
being why 42 is because when a supercomputer was asked what is the answer to everything in the Hitchhiker's Guide to the Galaxy, the answer came out 42. And we think this podcast is going to tell a lot of our audiences answers to their unanswered questions. So to start with, to introduce you very, very shortly without going into the accolades, you are at the cutting edge of minimally invasive surgery in India. And you are using the best possible technologies to treat patients surgically. So ideally, there are 3 categories of people I would never want to be with: a police, a lawyer, and a surgeon. But it's also good to have these people in great contact. So talking of surgeries, I want to kind of dip your fingers into a very burning topic everybody is scared of, is cancer. It looks like most surgeries that I'm hearing these days are going for some kind of tumor. Maybe it's tumor, it's fibroids, something of that sort. That's an outgrowth on the body. Why is there such a massive rise on all these growths inside our body these days? Why are we having these problems these days?
Yes, so there are 2 aspects of it.
Yeah.
One is definitely the lifestyle that we are following these days. That has been discussed a lot, I think, these days. The basic things being hurry, worry and curry.
Hurry, worry and curry.
Curry. Yes.
Okay.
So that is a dictum since ages. So always that's hurry as in the stressful life that we have these days. Always, up to something, we need to do this, we need to do that. Having that stress in your mind, that affects you a lot. Then there's worry. Again, a different kind of stress. कि अगर मैं ये करूँगा तो क्या होगा? अगर ये नहीं करूँगा तो क्या होगा? There's anxiety. And there's curry. That is your eating habits. So this was a dictum since ages, but now it is being placed very well. Achha. So when we talk about lifestyle changes, what else? Then hurry, worry, and curry. That has to be changed. So it is basically one aspect is definitely the lifestyle change that has happened over years, and all that stuff that we have on internet these days and that we discuss about largely about all those wrong lifestyle choices, wrong food choices that we have, the junk food, etc., etc. And there's one more aspect I think I would like to touch about is with advancement in medical technology and the investigations and the imaging studies like CT scans, MRIs, PET scans, all those have also increased over the years, and the diagnosis has also increased. Definitely, the cancer is on a rise because of all the changes that those have happened in a few years or last maybe 2 decades. But the diagnosis has also improved. If you can remember, say 20 years back, if there was a death in the family, it was just there, a death. So we did not go into the depth of it. It was just because it was age related or something like that. We used to coin something and that is it. But now with advancements in these investigations and imaging studies, all these tumors and the cancers are diagnosed well. So in any patient, be it elderly, a young patient, all these diagnostic modalities have increased by leaps and bounds. And that is why we are coming across more incidences. Maybe 2 decades back, those tumors weren't diagnosed for the patients. And that is how the patients or some family member, they used to be affected by those, but were never diagnosed.
So with all these advancements, how early is it able to identify? Is it identified once cancer has begun, or you have possibility to identify that I am at a risk? Of course, telltale habits, if I'm smoking, I have added a risk factor to me. But genetically, is it possible to identify most cancers as a risk?
So there's something called as screening that is happening these days.
Achha.
So there's even in corporate offices, there's a screening protocol or a health checkup, as it is called in layman's terms. So health checkup is nothing but getting your body checked. So there's sonography, ultrasonography of the abdomen. There's chest X-ray. There are a few blood investigations done in people, wherein most of the tumors or the cancer markers are checked, and definitely those can be ruled out. So it is of utmost importance. Even the insurance companies, the medical insurance companies are promoting screening tests.
So they have separate insurances just for cancer, because it can be financially debilitating. And then your 5 lakh, 10 lakh cover is not going to cover a basic cancer.
There's something called as critical illness cover. There's cancer cover. Many aspects to it. But screening is of utmost importance. So right now, a male or a female in 30s is also screened regularly. There's a health checkup once a year. An educated family has a health checkup once a year. So many tumors and many cancer related issues are dealt with during that checkup. If you are smoking, if there's tobacco consumption, if there's something else that is affecting your lifestyle. So according to those habits of yours, the screening is done. So that helps in definitely diagnosing a tumor or a cancer patient in early stages. Yes.
If you remember back in the day when we were younger and we used to go to movie halls, in the interval, Mukesh was the visual symbolism of cancer. And it was all about mouth cancer, tambaku. And then baad mein thoda sa, I think recently we have seen ads about lung cancer, smoking and air pollution. But the question is, it appears to me from my initial study that the type of cancer is very much prevalent geographically. Different cancers are prevalent in different parts of the world. Like बहुत well-known fact है, Japan में anything to do with GI is a big incidence rate.
Yes.
So as Indians, and Indians is a very broad term these days. पहले से भी है. I mean, we are so different across the length and breadth.
Yes.
Do you have any sense which cancers are more prevalent in India, and are there any geographical pockets that have shown different cancers being more prevalent in these different parts of India?
Yes, there are many details to it.
Achha.
But as we know, the tobacco consumption or the tobacco chewing is rampant in India. So oral cancer is definitely
the largest.
Yes, it is the largest. You can say one of the largest cancers found in India. The oral cancer. Smoking is also a big thing. So the lung cancers are also on a rise, and definitely we find lung cancers in Indians. So if you see the scenario these days, all the cancers are on rise.
Achha.
Yes.
So there's no exception to it. Because I'm seeing a lot of colon and colorectal cancers also becoming more, and it's happening at a much younger age, it looks like.
Yes. So all these cancers right now are on a rise, all because of the lifestyle changes and the things that we mentioned earlier.
And in women, will it be more apt to say that it's the breast cancer and the cervical cancer that you're worried about, or are there
there's
others?
Breast cancer, there's cervical cancer, there's ovarian cancer.
Achha.
So a lot of those
Very
cancers
significant in India right now.
Yes. We are getting patients of all those types of cancers.
So on as we speak about cancers, it looks like the HPV vaccine, the cervical cancer, is the only cancer that seems to have a vaccine. Why is that? Why is that a little different in its treatment?
Now, with advances in medical science, like I said, they're definitely trying to find a cure for cancer. But every day there's some positive thing that happens. In research, there's obviously there are ups and downs. So we are trying and finding out. The scientists are doing their part, finding out a cure for cancer, and hopefully we'll have it in a few years. Let's hope for the best.
You seem very optimistic. How near are we to that scenario according to you?
It can happen anytime, actually. See, the research is going on since years. There are, like I mentioned, there's positives and negatives to it. There's ups and downs. So whenever they'll find it, they'll bring it to the notice of the people and get it into the market.
How much would you believe in a conspiracy theory that it's in the interest of the whole healthcare system to not have a cure go out as quickly as now?
That's controversial.
Yeah.
I mean, I can't analyze that because you need to have a good knowledge about the pros and the cons and everything that is going on in the industry. So people like me who focus on their work and actually don't have much time into going into the conspiracy theories. It's quite difficult on my part to talk about it. But like I said, there's no everything is not positive always.
Right.
So there has to be something that is holding something back. We don't know.
So
Say about it.
You make a lifestyle a big culprit in the rising case of cancer. Now, if I'm eating food and food can be addictive and there's no warning signs, and hopefully there will be soon on labels and stuff on the processed foods at least, we'll get more aware about food. Now, if you look at smoking and tobacco, it's evidently clear to everyone there is no health benefit of indulging in smoking and tobacco. In fact, the packaging of cigarettes don't make it an appealing choice at all. So have you wondered what's going into the psyche of somebody who says, I am now going to start smoking and I've gotten this packet and there should be enough warning there and I'm not stopping?
No, the young generation, what happens is they have friends around. They have that ego and that, proving something to somebody. They have that feeling in them. Now one of my friends is smoking, so he looks cool, or there's some factor to it that is different from us. What is the factor that is different from us? That he's smoking. So let's smoke. Let's try that. It starts there, and then it goes to addiction. So at a point in time, it is just trying, and then it goes to chal ek roz ek peete hai karke. It goes on increasing, and then to a point where you consume maybe a packet or two daily, and then that addiction is very, very hard to get rid of.
So At this point, WHO says that up to 5 cigarettes a day increases your risk multi-fold times. But WHO a few years ago also said overconsumption of processed red meat is also now a carcinogenic risk. The key point over here to understand for all of us is there are causes and there are risks. So when they say it's a risk, because you're now getting into fairly controversial territories by saying whether you should be vegetarian, non-vegetarian. We don't have any dearth of these controversies. So please explain to our audiences, what does a risk factor mean, and does that mean that if I have cigarettes, or because you will always hear people saying he smoked all his life and nothing happened, and I was there and I had no vices, I used to sleep early, and here I am with a cancer. So risk factors and causes, are they similar? What is the difference between them, and how should we analyze our risks?
When we talk of risk factor, so anything that is a risk factor is that thing that increases your chances of having cancer by so and so percentage.
Achha.
So even if a person who is not person one is consuming tobacco in some form and the other is not consuming a tobacco in some form. So let's say smoking. So the one who is smoking definitely has more chances of having cancer related to the.
So we are talking probabilities here.
Yes. It is, and it is a proven thing. If we go back and analyze the studies that have been done, definitely the smoking group definitely has more chances of having lung cancer compared to the non-smoking group. The person who says कि मैं कुछ नहीं करता फिर भी मुझे cancer हुआ is those people are very few. But जो सब करते हैं उनको कैंसर होने वाले ऐसे ज़्यादा लोग हैं comparatively. So that is what we need to focus on. कि बाबा ये risk factor term किया गया है तो it is definitely a risk factor and we should stay away from it.
I would assume that despite knowing the fact that it's a risk factor, if I'm indulging in it and not occasionally, fairly regularly, I'm also going to ignore the telltale signs that something is wrong. So for example, if I have been consuming any of those products that can have a risk to mouth cancer and I'm getting ulcers, there is a very natural tendency, ulcer hi hai, dekhenge, karenge. Do you think people are coming in for diagnosis really late because they don't worry about these symptoms early?
There are a few people who consider ignorance is bliss. So kuch nahi, hota rahega. Like we had in COVID times. People weren't ready to accept that this is something serious that is happening to us. अरे क्या खांसी है, क्या होगा, देख लेंगे types. That is not to be done like that. You have to take your health very seriously, and otherwise it will bounce back. Like people had COVID and there was the numbers that we had, the deaths and the morbidities that we had during COVID times was traumatizing. Because people did not take the telltale signs seriously. They did not follow the instructions. Now the people, those who are using masks regularly, avoiding contact, staying away from, obviously those people did not, the COVID did not affect them as much as the people, those who were bindas and saying कि कुछ नहीं होता देख लेंगे. वैसे ही it is about these risk factors also. You have to take those things seriously. When somebody has done some research and there are papers saying there's research saying that these are the risk factors and you should stay away from those, people have to take it seriously, otherwise that is going to affect them.
I want to change because you mentioned COVID, I want to change the track just for a bit and ask, post-COVID and post-vaccination, now that probably the entire nation has been vaccinated at least twice, a large population of us is, have you anecdotally seen a change in the quantity of patients coming in for surgeries? Has COVID affected other systems in the body? Do you get a sense for that?
Other systems as in respiratory systems, yes.
Achha.
Definitely it has affected the respiratory systems in many because there were a few changes in the lungs and the lung tissue that were found out in CT scans post-COVID infection.
Yeah.
But other systems as in with time, obviously we coped up with those and with that scenario, and we were really the people who were again having good lifestyle, people who were exercising well, they were comparatively less affected by COVID. So it is the same thing. So you need to be really thoughtful about it. So other systems, as in we've heard instances of people having more heart attacks or something like
brain strokes.
Yes, brain strokes after COVID. So that relation has to be
established.
Now again, yes, the researched upon.
There's no like after 4 years we don't have enough studies to correlate those.
We have studies wherein there are a few things. Viscosity of blood has increased and all.
Achha.
There are a few papers for it, and there are a few papers or research papers and that deny that also in a certain group.
Yeah.
So I think that is not a definite. There's no definite cause which is causing that. But again,
anecdotally, a very dear orthopedic surgeon, a friend of ours, mentioned that he has seen an exorbitant rise in necrosis of the hip, probably because COVID was a clotting disease rather. It was a blood disease rather than respiratory, as it is believed by a large part of experts.
Now, any disease or any virus or any bacteria that goes into the body, it definitely affects many things, many systems. So, in one person, it may just affect the respiratory system. In another person, it may affect the respiratory along with the cardiovascular system. So the scenario is different in every person. So, but we generally, what we as doctors observed was the people who are actually into good lifestyle habit, in a good lifestyle habit, and people who are exercising well were comparatively affected lesser during COVID times also. So it is again same for the cancer part also. You need to have good lifestyle. You need to have it is always told by everybody.
And ignored by everybody in the same zest. While we are speaking on cancer, it appears that there's often, I have had a few cancer patients in my family, some really dear family members. There has been a cases of breast cancer, there has been a case of a mouth cancer. And there was a case of, and you treated one of those patients wherein there was a case of liver cancer, if I'm rightly calling it.
Biliary tract, yes.
Yeah, biliary tract. And it seems like there is a certain sense of optimism that relatives tend to bring to the conversation once somebody is diagnosed, saying, "अरे lucky है तू कि तुझे mouth cancer ही हुआ, इससे कुछ ज़्यादा नहीं होता." It's curable. Most people will have a longer life and all. So do you have a sense, like, what are the worst cancers you pray never happens to anybody? And
no, any cancer is dangerous.
Achha.
So yes, there are a few pros and cons. The treatment modalities different for different cancers. So the seriousness of cancer is always when it is diagnosed. It depends on when it is diagnosed. If it is diagnosed in early stages, definitely the outcome or the chances of the patient getting cured is definitely more. So early diagnosis and early treatment, like we all emphasize, is very, very important. And there the screening comes in. So any cancer during screening or any tumor that is diagnosed at an early stage, the chances of that being cured are definitely more.
You sensed any positive miracles? Like, you would count it as a miracle as a professional. Do you have any examples? Like, I never gave this person so much life and this person seems to be at odd odds against the nature.
Yes, a few people are very resilient. So there's positivity in them. There's, they follow everything to the bone. Whatever doctor tells them, whatever their support staff or the healthcare staff suggests, and they follow everything to the core. So all these patients, and they are very resilient and positive. So definitely mental strength is definitely important in having, when you are dealing with any stressful situation in life, be it cancer, be it any other situation. So being that a good positive person, a strong person mentally, definitely helps.
So would you rank it like right at the top in qualities of patients who are likely to have better outcomes?
Yes, definitely.
Over medication, over access to better healthcare and other things?
So we have access to, all the patients have access to good healthcare when they come to us. So they have all the support staff is the same. The doctor who is treating the patient is also the same. So eventually it comes down to the attitude of the patient. So when they are strong and mentally strong and they are prepared to overcome that disease, it definitely helps.
Can you tell an example to bring some positive morale to our audiences who are probably unfortunately going through cancer? Like, can you give an example of a miracle that you count as truly an extraordinary feat of nature?
Yes. So there was one patient who came to us with cancer spread to the entire body. Achha. So it was a stage 4 cancer, and
it's called. I did a little bit of research. So it's called metastasis, right?
Yes. That was metastasis. Yeah, that means cancer had metastasized everywhere in the body. Yeah. So we counseled. The biopsy was done. The diagnosis was done, and then that patient always, since his first meeting with me, he always said, "Doctor, तुम्ही आप मुझे बताइए, आप क्या करना है? मैं जो आप बोलेंगे वो सब करूँगा और मैं इससे बाहर निकलूँगा." This is the attitude that he had since the beginning, since day one. We diagnosed the patient. We started the chemotherapy for him. Thankfully, the tumor that he had responded very well to the chemotherapy, and he was totally, the cancer had totally gone after the chemotherapy cycles within 6 months. Oh. So, and after the cancer, after the PET scan that we do for screening, after that he himself came with the report and he said, देखिए डॉक्टर, हमारी जैसे बात हुई थी, मैं लड़ा हूँ कैंसर से और इससे बाहर निकला हूँ. That type of patient with a stage 4 disease coming out of cancer, living his life well, and definitely we keep a watch on him. There's a follow-up every 3 months. Every 6 months there's a PET scan that is done for him, just to be sure that it is not emerging back. But like I said, with that stage of cancer and getting out of it, definitely there has to be something inside of the attitude of the patient. There's the treatment that is received by everybody, but when you are mentally strong, it definitely helps. That is where spirituality also comes in.
Do you believe in God?
Yes, I believe in God.
So yes. How should I feel if I'm on your table and you start saying, "Hey God, please save this patient"? How should I feel about it?
What I think is the spirituality or God is in everything, is what I think. So you need not go to some place, a specific place wherein you worship God and you come back and only then you will be able to perform good surgery. It is not like that. You can always जो स्मरण करते हैं हम, you can always do that anywhere. You can be sitting in your house, you can be sitting in your OPD, you can be sitting anywhere. You can just have a nice prayer in your mind and you can go ahead. So what is spirituality? So what I think is the spirituality is something that keeps you grounded. So what is that exactly? So in our walks of life, in everybody's walk of life, there are a few moments wherein you start feeling that you've accomplished this, you've accomplished that, you've reached that stage of life. So there's a certain high that you have reached. So when you reach that high and you have start having that God complex, so there should be something that keeps you grounded, something that tells you, Baba, stay calm, धीरज रखो, be grounded. So that is what spirituality is to me. So there's some entity that is, telling us to be calm your nerves. Okay, you have reached here, but still be calm, be humble. So that is spirituality to me. So everybody can interpret spirituality in their own way. Yes. That is what I feel. So that actually helps me during the surgeries. So like we discussed, there's a point where surgeon has to know where to stop. So there's something, this spirituality also has a role in controlling my ego.
But you're not saying मैंने जो करना था वो कर दिया, अभी इसके आगे fate भगवान के हाथ में. That's not the approach that you're taking.
That approach, see, we have medical science to deal with it. So ऐसा नहीं है कि सब भगवान के वो जो डायलॉग्स होते थे मूवीज में, वैसा कुछ नहीं होता. Every doctor keeps doing his or her best. And they keep supporting the patient. So it is not like अभी मैंने जो करना है वो कर दिया उसके बाद अब भगवान देखेगा, ऐसा नहीं.
Very filmy.
Yes, God helps those who help themselves. Basically.
Very well said.
Yes.
Very
So
well said.
you have to have faith, but along with that you have to have the right attitude also. Otherwise, there's no point in just having faith in God and thinking that only God will do everything for you. It is not going to happen.
We're going back and forth into topics because you're kind of teasing me towards different directions.
Yes.
Earlier in our conversation, you mentioned about chemotherapy and somebody recovering through chemotherapy from stage 4. Now, when you say cancer, the first thing is cancer. The second is chemo. And probably the third is radiation. And all of those words strike a chord of fear. None of these give you any pleasure or any satisfaction कि ये सब काम करने वाले. The foundation is of fear. So is chemotherapy changing? Because your surgeries are changing. Is chemotherapy?
So in cancer, like we always say, there's 3 different scenarios. So for cancer, there's multidisciplinary approach that we take. So there's one oncosurgeon or cancer surgeon.
Right.
Then there's one part wherein there's a medical oncologist or chemotherapy dene wala doctor. And there's third, there's radiation oncologist. So radiation या layman's terms में light या radiation देने वाला doctor. तो ये तीनों जो है, this is a multidisciplinary approach that we take. So according to the stage of the cancer, that treatment or the approach is decided. So there's something called as a tumor board or a meeting that happens. And we discuss all these things depending on the stage of the disease that the patient has. We formulate a best possible route for him. So that is how it works. And it is for the best interest of the patient.
See, what has typically happened is you fall sick. I mean, it could be as simple as a cold that I'm building up right now. You are bombarded with advices from everyone. I mean, there are a lot of WhatsApp gurus and Google gurus, and it's coming from a place of, well, good intentions. It's coming from a place of help to the patient. When we were having our cancer patients and our go-to route was the advanced medical care, what we call modern Western medicine or allopathy, there were a lot of kadhas and churnans and other homeopathy and other things, lifestyle diseases, things to cope with other lifestyle diseases that were gotten advised. बहुत सारे सुझाव है कि you should start drinking bottle gourd juice because it makes the body alkaline and things like that. How much is your belief system in these other parallel medication methods, and when is a good time to start saying, I'm primarily going to talk to you and I'm also talking to somebody else and we are going to do a bunch of things?
Yes. So
is that okay?
Now modern medicine, yes, that should be the first defensive thing that we do. So we continue with all these medications and all, and then when we put in front the modern medicine or the allopathy, I believe that that should be the front runner. And then according to that, then you can discuss with the parallel therapies if that is going to work with this. So collaborative effort कुछ हो सकता है क्या? And likely and then decide upon a certain thing that बाबा हाँ ठीक है ये चल सकता है. So what can go along with the modern medicine? Yes, you can opt for it. But the center stay or the front runner should always be the modern medicine which has proven benefits.
But that's also the accusation against parallel medicines, wherein the structure our traditional medicines have come never had evidence-driven studies. They are blamed of not bringing evidence to the table, and in their support they also say that we are personalizing our medication. So it's very hard to bring evidence when I'm customizing my therapy, understanding you as a person. So how many allopathy doctors would have good belief in this, or they are like, there's no harm, why not just do it? If it benefits, so be it. Or there's good belief that you're bringing with this parallel medicine now in your thing?
Since we have not studied the other modes of this thing, say homeopathy or Ayurveda, so I'm not in a position to comment on any treatments given by
Right.
those branches.
Right.
But yes, we have had patients who have kept allopathy or modern medicine as the front runner, and along with that, they have opted for the other parallel medicine therapies also. So it is okay as far as it doesn't affect the patient in a bad way. So that is how a few people, they collaborate and they keep taking those medicines also. But commenting on those, I'm not the right person maybe, because I haven't studied those.
So I have had an interesting journey with cancer because it affected not a human family member of my household, it affected my dog. And my journey in cancer started there because I started asking, why did the dog get cancer? Like every Google research will tell me. It looked like most of the articles were saying it's probably, I mean, it was 14 years old at that point in time as well. So you're not too worried. Ho jata hai. What you mentioned, early, old age se hi gaya. But because I could see tumors, it was easy to diagnose.
Yes.
So my journey of researching a little bit about cancer started because of my dog. And we ended up actually coming up with a whole nutritional belief system, how we should feed our dogs, because I'm a vegetarian. So that was the starting point. The point to note is there is some preliminary research that I did, and because cancer is often a response, and reaction is probably a better word, it's a reaction to some abuse that we create in our system, some intakes that we do. Cancer until recently was believed to be a disease of humans. It's now being seen in pet animals because we are abusing their bodies as well. However, with the caveat that nobody has really gone and checked a dead tiger to see whether it had cancer or not, there are very few studies that say wild animals have cancer. Do you think cancer is a very human issue or a human created issue in the modern world, philosophically?
So now what is cancer exactly? It is nobody can put cancer in your body. It is not an infection that somebody else has and you get it. The cancer is something, the normal cells in your body, they multiply and they cause a tumor-like situation or a scenario, which is called cancer. So it can happen in any living being. So like you mentioned, the dog or the pets can also have tumors in their body. So it is not human related per se.
It's a human intervention is what I was trying to hint at. Like we've started feeding them commercial pet food processed and all.
So it may be the case or the scenario, or it may be the another scenario that we discussed that wasn't diagnosed before.
Correct.
Now it is being diagnosed.
Correct.
So,
but that's a very interesting aspect that I'm trying to understand for my pet nutrition company. Why are dogs and cats getting cancer? And there's a very interesting anecdote. There's a person, Rodney Habib, who went around finding the oldest living dogs. And he found dogs which were 32 years old and 31 years old. And he's given a TED talk called The Forever Dog. And he says the big difference, the commonality between all the long living dogs were they were exercising tremendously highly. They were burning all the calories and they were eating all natural food. So something alluding back to what you're saying, it's curry, worry.
Hurry, worry and
curry.
Yes.
I think all these dogs were immune to those systems. Let's dive in directly into what is minimally invasive surgery, why is the practice that you do the most advanced? And then my follow-up question is it on par with the world globally, or are we a few stages behind? So in that sequence, if you could explain, that would help our audience understand what do you actually do?
Yes. So when we talk of minimal invasive surgery, so as the name goes, it is minimally invasive. So the traditional way of doing surgeries was always an open surgery. So wherein there was a big cut on the abdomen or on the chest, and we used to do the surgeries. So as we go ahead with time and there are new advances in medical science, so this minimal invasive aspect is wherein you put small scopes inside the cavity, as in the abdominal cavity or the thoracic cavity or the cavity inside the rib cage.
Achha.
So that is called thorax. So that is thoracoscopic surgery. And in abdomen, it's laparoscopic surgery, when you put ports or small instruments inside the abdomen and you complete the entire surgery. So with time it has progressed. So before at the beginning of the era wherein minimal invasive surgery was, it started and it was progressing. At that time there was a fear in minds of people wherein complete surgery, can it be done completely with the use of small instruments and scopes. But as time progressed, that has improved. And now we are able to do all the surgeries, almost all the surgeries, minimal invasive way.
So to give us an example, when you say all surgeries are possible through a small keyhole in the body, set the tone for it. Like what is possible? Like,
yes. So
can you remove the
all the organs inside the abdominal cavity or the stomach, as it is called in layman's term. So we go inside, we put a scope inside, and we can have a look of the entire abdomen through that small scope.
Using cameras?
Yes. So a camera is attached to that scope and it displays an image on the screen in front of the surgeon. So we that image is relayed to the screen and we get a actual real-time picture of inside of the abdomen. So what we actually used to get after opening the abdomen, we get the entire picture just by putting a scope inside. So after that, there are small instruments that are put inside from small ports of 5 mm or so. And the entire surgery can be performed by using that camera and the ports. And the technology is advancing with time. So there's 3D cameras, there's robotic surgery is coming up in a big way. It is already here. And there are a few advances in camera systems which help the surgeon to perform complicated surgeries well. That doesn't mean the surgeon can be mediocre. The surgeon has to be equally skilled to use those advanced instruments. So that's where the advanced minimal invasive surgeon comes into picture. So that is advanced minimal invasive surgery. So it includes any surgery that is performed the minimal invasive way, say robotic surgery. There's thoracoscopic for the tumors and the ailments inside the rib cage or the chest cavity. There's laparoscopic surgery for ailments and tumors inside the abdomen. So these are cavities. Right. So these are cavitatory surgeries.
Right.
There's something also called as non-cavitatory minimal invasive surgery.
Achha.
So wherein there's
cavities nahi hote.
हाँ, so जहाँ पे cavities नहीं होते, as in this part, the neck part, wherein there's thyroid here, there are lymph nodes here. So traditionally we used to take a cut over the neck to perform a surgery of the thyroid gland or the parathyroid or the lymph nodes in the neck. But nowadays with minimal invasive surgery, there's no cut that is taken here. So once you wear this shirt, the people can't even say that there's a surgery performed.
Correct.
So in a cosmetic way also, it helps. So especially in young females say, or young males, they don't want a scar on their neck. It is right in front. So they prefer the minimal invasive way, wherein we put scopes through below the neckline. A small scope of 1 centimeter goes inside, and similarly the small ports or instruments of 5 mm go inside. From there's a triangle formation. And from that, the entire thyroid surgery is performed by looking on the screen.
So this almost sounds like you're doing, this sounds like playing video games, because you need to have really good dexterity with your hand tools and you're performing at a far end. Now, I remember when I was training for human factors of medical devices, we said that if the point of operation is closer to your body, you will have better control. So talk about how do you practice for the control? Like, looks like a guided surgery.
Yes.
So as you said, a lot of it is technology, but a lot of it is your skill of knowing what to do.
Definitely.
So how do you train for this?
So the thing
play
is,
a lot of video games?
I did not play a lot of video games, to be frank.
Yeah.
But yes, the hand-eye coordination definitely comes. I think it comes good to us, this generation. who had video games in the background. The generation previous to us, they did not have video games. That doesn't mean there are no minimal invasive surgeons of that generation. There are a few and world famous ones. But this generation is definitely more, easy going with that type of scenario, because there's the entire thing depends on your hand-eye coordination. So you put the ports and you work with your hands and you see the screen in front of you. So it is not like you see down and you at the place where you are performing the surgery. It always gets relayed on the screen in front of you. So that is minimal invasive surgery. So definitely it requires a great skill, and you have to have very good hand-eye coordination and surgical skills. So training is as any training goes in any field, it is step by step. And at a certain point in time, you get very good at it and skillful at it, and then with confidence, you can definitely perform those surgeries.
It appears in your initial spiel that मिनिमल इन्वेसिव का सबसे ज़्यादा फायदा ट्यूमर निकालने में होता है. क्या that is the minimal invasive surgery field limited to that, or are there repair surgeries that you're doing? What are the typical kind of surgeries that you get to see from an incidence rate point of view? Like, what are the patients coming to you on a daily basis?
Minimal invasive surgery does not just mean removal of tumors and cancer surgery. It is definitely corrective surgery or general surgery that is also included in minimal invasive surgery. So general surgery में क्या आता है? So there's hernias, there's appendix surgeries, there's gallbladder surgeries, gallbladder stones and all. All these surgeries which were generally performed by open route a few years back are now totally done minimal invasive way. So even those surgeries, so corrective surgery like you mentioned is the hernia surgery.
Correct.
Even that is done the minimal invasive way.
Right. And the recovery is faster in that
recovery
case.
is tremendous. I mean, the patient stands on the day of surgery itself.
Achha.
There's walking involved on the next day, and in simple surgeries like hernias and appendix surgeries and cholecystectomies for gallbladder stones, the patient can get discharged the next day or in one day also. Achha. Sometimes we even discharge the patient on the same day.
Achha. It seems like the game of surgery has changed drastically.
Yes.
And open surgeries are being replaced by more and more of minimally invasive surgeries. So at this point in time, what's the most complex surgeries that you have handled using the state-of-the-art tools that you have?
I'll share a few experiences with you. So there was the tumors in the lung are very complicated to operate. So essentially for a few years back, they were all taken out by cutting open the chest and delivering the tumor out. But it caused a lot of pain, and the recovery period after that surgery, open chest surgery, was tremendous. I mean, patient used to be bedridden for a week or so and then get up, and so we've cut that to the minimal invasive surgery era, wherein we put scopes. So I've done a case wherein there was a big tumor. Of course, there are multiple procedures or investigations that are done for the tumors. So there's multidisciplinary approach wherein according to the stage of the tumor, it is decided whether we can operate it, or we need to give chemotherapy before it or radiation before it. So this particular tumor, I remember we operated upon the patient. So we had to remove the entire half of left side of the lung. The left lung has two lobes or two parts, upper lobe and lower lobe. So we had to remove the entire upper lobe, right from its the beginning of the upper lobe, the bronchus. So we removed the entire tumor along with that upper lobe or the half of the lung by using those scopes and instruments. So I think the surgery time was maybe 1.5 hours, 1 hour to 1.5 hours. The patient was walking the next day. That was and there was one patient who had undergone a surgery the traditional way also, the open surgery, at the same time in the hospital. And I remember that patient wanting to walk, but he couldn't because of pain.
So why was the decision for one patient different from the other? What were the governing
It depends
parameters?
on the surgeon and the size of the tumor.
Achha.
There are a lot of things that go into it. So for this particular patient, we could do it the minimal invasive way,
Right.
and we did it thoracoscopically,
Right.
as it is called, rightly. And that patient recovered well. He was discharged on the 4th day itself. So that is very beneficial to the patient.
Right.
So the recovery time is less, and it is not like we couldn't take the tumor out completely. That is a myth or a misconception that people have. That if you do it laparoscopically or thoracoscopically or the minimal invasive way, there's a general propaganda, you can say, wherein people have this misconception that that entire tumor will not be removed. It is not so. I'll emphasize. There's according to the new techniques, the new era of minimal invasive surgery, a good skillful surgeon, and these new techniques and the technology that we use, definitely we can take the entire tumor out without any doubt.
What was the size of the tumor in this particular case?
In this particular, it was 6 or 7 centimeters size of the tumor.
And
But the lung is deflatable. So
Achha.
once we take the tumor out, we put it in a bag and then remove it through a very, very small incision.
But what I'm trying to understand is, let's say there is a tumor. Now I'm imagining everything in 3D at this point in time.
Yes.
The tumor is, let's say the lung is a 3D organ and it's on the back side of the lungs.
It's like a balloon.
Yeah, so the lung is inflated, but the tumor is on the back side.
Yes.
So how do you plan? Like, would you go from the front? You can flip the lung over. Would you go from the back? What is the general plan to go there? And then
Yes.
if you know the tumor size, it seems a far stretch of imagination for a layman to imagine that a 7 centimeter, 8 centimeter long tumor, you call it a bag, and I'm still struggling to wrap my head around what's the visualization of the bag, but you're pulling it out through a 0.5
Yes,
port,
yes.
as you
Small
described in the
incision,
beginning.
Yes.
So how is this
So-
working? Like I just want the visual of it.
Yes. So we tilt the patient on one side, and the side of the tumor, it comes up, and we put ports through the rib cage. There's space between the ribs.
Oh,
So we put small 10 mm ports, so 1 centimeter port through it, and from that we put the camera and the scope inside. So we have an initial visual of the tumor, and then we, according to the location of the tumor, the ports or the instruments are put in, and then the surgery is performed.
So you're grinding the tumor, you're making it into smaller pieces in
No,
the bag. when you're
then
pulling
we
it
put
out?
it in a bag. So bag is inserted through those same ports. We put it in a bag, and the tumor is then cordoned off from the other tissues surrounding it. And then while taking it out, because lung is a deflatable organ, it is like a balloon. Once the air goes, it deflates. So we can move it and then take it out through a small incision.
This is sounding too good to be true.
Yes.
Tell us something, some more of your surgeries. Like this is a tumor. What else?
So this was about the lung.
Yeah.
So it was the chest cavity. So there's something called as thymoma or a thymic tumor also
Achha.
in the chest that can be performed the minimal invasive way. So I've performed those surgeries too. Quite complicated because there are major vessels. There's heart below. There are major vessels surrounding that tumor. So it definitely requires good skill and good instrumentation and the medical setup. Then I remember this specific case wherein a lady had got operated for an open surgery. She had got operated for the removal of the uterus.
Right, the hysterectomy.
Yes, the hysterectomy surgery. So she was operated 13 years back, and she came to me through a friend of mine who is a doctor. He referred her to me because he knew I'm doing those complicated surgeries. So she came to me with a complaint of, it is quite traumatizing for a patient to have that fistula-like thing wherein there's a connection between the urinary bladder
Right.
and the vagina
Right.
after the surgery.
Right.
So during the healing process, there must be some injury or something, and the connection was causing the urine to drip through the vagina all day long. So it was really traumatizing for her. So for her, that corrective surgery in itself is very complicated to perform, and I'm so happy I could do it the minimal invasive way. So we put a laparoscope inside the abdominal cavity. There were a lot of adhesions that we call. Adhesions are the tissues that have stuck after the previous surgery. So we need to actually navigate through those and reach a point where there's problem. So we could find that fistula, we could separate it well, and then we could separate it and then repair the urinary bladder through which it was leaking, and also the vaginal vault through which it was leaking. And then we put a omental patch, which is called. Omentum is the fat layer inside the abdomen. There's a what is it? I mean, omentum is a fat curtain-like thing inside the abdomen, or it is also called as the policeman of abdomen. So we put that layer in between just to ridge off those connecting points. And she recovered well, and after 13 years of this agony, she came out of it, and it was really satisfying as a surgeon also. And she came for follow-up, and the problem was solved. So these complicated surgeries are also being performed the minimal invasive way in this today's era.
What I'm getting out of your conversation right now is that there is a scope for tremendous amount of creativity in your surgical practice. मेरा ऐसा मानना था, हालांकि मैं मेडिकल डिवाइस डिज़ाइन बैकग्राउंड से आता हूँ, तो हम इनोवेशन के पीछे ही मेडिकल डिवाइसेस के पीछे दौड़ते रहते हैं कि ये सर्जरी और किसी तरीके से हो सकती है क्या, ये प्रोसीजर ही चेंज कर सकते हैं क्या, हमारे दिमाग में चलता है. But not all doctors are receptive to experimental approaches, for example. Because I can understand the risk of experimenting with a live body. So how do you resist? In designers, we call it the ego of creativity. Like, let me be really bold and do something. How do you resist that zeal that, oh, I have this fancy tool and I can do wonders, but where do you stop? How do you decide what's the end point of being creative in a surgical procedure?
So I always think that there should be something that keeps you grounded. So that God complex has to go. So at a point in time, yes, when you are successful, you are a good surgeon. So there should be something that holds you back also. So in surgery, we say you should always, a good surgeon always knows when not to perform a surgery. Or when not to operate. That is definitely the training that teaches you that you need to stop here. So there are pros and cons. There's a very thin line between confidence and overconfidence. So you need to make out and then stop there and then think about it and then go ahead.
Some decision points that tell you now is the point to stop. What are those decision points?
Those decision points they come with time. You get trained for it. So with experience, you can always tell the difference. So this is there's a difference between an experienced surgeon and an inexperienced surgeon. So this is what it is. The experienced surgeon always knows when not to operate. It is a dictum in surgery that you should know when not to operate. So that is how it is. So always we think about the betterment of the patient. We have that thing in the mind always. So the ego has to go, it has to take a back step, and whatever is beneficial for the patient, only that has to be performed or done.
Did you always want to be a surgeon?
Yes, because my dad is a doctor, my grandfather is also a doctor. So I've been seeing patients and dealing with the patients and that scenario since my childhood. So I always wanted to be a doctor, and then later on I always wanted to be a surgeon also. After seeing that scenario and people getting benefited from what my dad was doing or what my grandfather was doing, I always wanted to be a surgeon later on.
In medical education, it's often said you can't choose the stream chooses you.
Yes.
Because the seats are so far and few. So tell us how you were getting your hands deeper and deeper into, how did you end up into minimal surgery. And would you be called a general surgeon, or what's the
It
specialization
is
that we call
advanced
you?
minimal invasive surgery, and
Acha.
I do cancer surgeries also.
Acha.
So
So is
it's
that a different
advanced-
name? Like, is that an oncosurgeon now?
Yes.
Acha.
So with experience, it is obviously all the horizon changes. So now I'm more into the advanced minimal invasive surgeries. So those include cancer surgeries or include corrective surgeries like hernias and all. Then there's, like I mentioned, thoracoscopic surgeries inside your chest for the tumors and other ailments. So all these fall into the advanced minimal invasive category.
अच्छा, इसमें एक बहुत बड़ा सवाल आ रहा है मेरे दिमाग में. जब हम डॉक्टर्स के साथ काम करते थे, you have such regimented specializations,
Yes.
like gynecology, ophthalmology. So you're treating almost like a specialty that treats one organ system at a time. Now you're telling me that as a minimally invasive surgeon, you would do a thoracic surgery, you would do an abdominal surgery, and you would do a uterine surgery as well. And perhaps you're also getting into the head and neck region as well.
Yes.
So what does it take to understand the anatomy? Like, how do you get good with all these different functions that seem like have their own respective specialties? Wouldn't I want to get operated for my lungs from a pulmonologist, for example, if there is a surgeon like that?
So we have a multidisciplinary approach. So there's a team that performs the surgery. So it's not the single surgeon that does it. So there are assistants, surgical assistants. Then two surgeons can do a collaboration and then perform that surgery. So like in the chest surgeries, you may always involve a cardiothoracic surgeon with you
Achha.
to perform the surgeries. So there's minimal invasive way. You have a backup of the cardiothoracic surgeon. Like in gynecological surgeries, we can collab with the gynecologists, and or gynecologist can collab with us, the surgeons. So we have this collaborations going on, wherein the patient, the benefit of the patient, the outcome is is of utmost importance. So there's no ego in between. कि ये नहीं चलेगा, वो नहीं चलेगा, ऐसा नहीं होता है. So in today's era, it is always teamwork that counts. So we definitely have collaborations, and we have our friends, our colleagues that help us out in different walks of different surgeries and at different levels. So that is how we go ahead.
Suppose there's a surgery tomorrow, and you were telling me that you do a lot of planning. Would you want to practice the surgery? Like, would you simulate it in some way so that you know what you're going to do? Because I've seen some videos that say, hey, surgeries nowadays are practiced well in before time, because now you have muscle memory to guide you. You're kind of trying to figure out, can some things go wrong and things like that. So how do you practice for a scenario that's supposed to happen tomorrow? And how often does it go off wire, and what's your response then?
So in surgery, we always perform the surgery in our mind first. So that is how it is. We also, till today, we refer to books. We go back to our basics. So everything is done before a complicated surgery. So on the previous day, there may be some doubts in my mind. So I need to clear those. I can go back to my books. I can come back. I can, in any surgery, that surgery is always performed in the mind first. And then we execute it on the table, on the operation table, like we say.
Right.
So there's a lot of thought that goes into it. There's a thought process. So if there's a scenarios, there are scenarios that are mapped out in the mind.
अच्छा, ये नहीं हुआ तो वो करेंगे.
So there's
ये
plan
होगा तो.
A. According to plan A, this is the. So the human body is very complicated.
Yeah.
It is not like you take a screw out of a machine and you fix it. It is not like that. So every body is different. So once we go inside and we know how the things are, we have already performed that surgery in our mind. So according to the scenario that is available, we go ahead and we perform the surgery. That is how it comes. The outcome is very good. So
what tool systems are you using? Like, is there a particular minimal invasive tool set that is preferred by you? And if you were to be given a different tool set, would you have a new training or struggle if you were to just find out there are new tools that I don't use? What's the scenario there?
The learning curve, initially, yes, it is there. But as you get into it and start performing surgeries regularly, I don't think those instruments make a big difference. I mean, the instruments have to be good, but the company actually doesn't matter. So you have good instruments, but you can test those instruments on the previous day of surgery, and if you want something specific, it can be ordered.
Because I remember there was this super ultra viral video that went wherein they were claiming that they are the first in the robotic surgery, and the video was a grape without even being fixed to the table was kept on a dish, and the arm came in a very robotic way and just peeled the grape without the grape even toppling. So it was trying to communicate that, see, my sensors or my dexterity is so critical that the grape does not even topple and I'm still able to peel the grape off. I think it's a very viral video that I remember back in the day.
So that was about robotic surgery. Yes.
Right.
So robotic surgery is about precision. So what that video was showing is that specific quality of robotic surgery, being very precise. So it is very, all these surgeries, be it minimal invasive surgeries like laparoscopy or thoracoscopy or robotic surgeries, all these are meticulous surgeries. So we need to perform those in a very meticulous way, very specific approaches that are taken, and that is how it is. So the precision and being meticulous, it is a part of being a surgeon. So that is how all these things come into scenarios.
Earlier you mentioned जो अच्छा सर्जन होता है उसको पता है कहाँ रुकना चाहिए. So what makes a good surgeon? A very open-ended question. Who's a good surgeon?
So a good surgeon, there are many aspects to a good surgeon. So there's a patient's point of view. There's your colleagues who have a point of view about you being a good surgeon. There's OT or operation theatre staff that has some point of view that whether the surgeon is good or not. So let's discuss the patient's point of view. So when a patient comes to you with his or her problem, she or he always has some agony or some negativity in him that is causing because of the problem that he or her
in distress.
He has. The patient is in distress. So any good doctor will first try and be positive with the patient. So those positive vibes are very, very important. So once the patient is comfortable with the doctor, only then he'll be able to understand what the doctor is telling him or making him understand. And being a good, positive person, greeting the patient well, talking to him, giving him or her time, and explaining things thoroughly as what he or she has and how we are going to deal with it. So that is a good doctor to a patient.
Right. So you're talking about user empathy at this point.
Yes. Yeah. And the doctor has to be positive. He has to give some positive vibes to the patient. Otherwise, there's no use. The patient coming in agony and the doctor just criticizing, "Arey, ye kya ho gaya tumko? Aise kaise chalega?" That's not the way. He's already in distress. So you need to calm him down. You need to give him a good hope and positive vibes, so that he'll be able to understand that you tell the procedure well. He'll be able to understand what procedure you are going to perform. So that is how it is. A good doctor to a patient is the one who understands the patient or him or her well, and is able to give him a good, because he's not going to come inside the operation theatre to see what you are doing. It is all about counseling and how you handle the patient's distress. So that is a good doctor to a patient.
But hope cannot be false hope. Have you had struggle communicating slightly disappointing outcomes to patients? I'm pretty sure you have had those occasions.
So there's obviously a negativity around it. So when a patient comes with the stage 3 or stage 4 of cancer, or something that cannot be corrected, so there's a certain way wherein you can convey it to the patient and the relatives. So it doesn't have to be very harsh. You can slowly get into that and explain it to them, why this is dangerous to you and how it has affected your life. It is true that it is causing that distress in your life, but definitely we have a few options like these. There's something called as palliative care, wherein the symptoms that patient is showing, or the stress or the pain that he or she is in, that can be handled. So there are many options nowadays that and there are counselors also available in the hospitals, wherein you can they actually counsel the patient. So if the doctor doesn't have that much time to counsel at length, yes, you can refer the patient to the counselors also, wherein they handle the mental situation of the patient and they calm the patient down. They counsel them how to react to the situations, the family also. So that is a big thing now.
So what is a good surgeon to the colleagues? You're mentioning there are three aspects of a good surgeon.
So a good surgeon to colleagues is the one who's very skillful, who the colleagues and the juniors or the staff, they can look up to him or her. So that is a good surgeon to the colleagues. So the one who comes in the time of help, if they want some help during surgeries. So the one who answers the calls, who comes to the aid of the fellow surgeon. So that is a good surgeon to the colleagues. So to the anesthetists that we have, or भूल तज्ञ जिनको बोलते हैं, उनके लिए एक सर्जन जो फास्ट सर्जरी परफॉर्म करता है and skillfully perform करता है, complications कम करता है, to them that is a good surgeon.
So speed is very important in surgery?
No, it is not actually important. But I'm telling you the aspect of or the psyche of the colleagues that you have. So obviously, if a colleague, if you are performing the surgery well and you get done with the surgery comparatively in lesser time, so definitely people around will like you because the work that they are putting in, that is comparatively less. Or the time taken is less. So the stressful situation that people are in, that is reduced.
Are doctors and surgeons in stress while doing surgeries?
So there are a few school of thoughts about it. So the stress,
I would want my surgeon to be in a little bit of stress.
So that stress you need to channelize well. So there's a complicated scenario, a complicated surgery that is going on. There's some bleeding or something that is happening. So there's a commotion in the operation theatre. So a surgeon leader always knows how to handle the situation and how to control the commotion around. So when there's a complication, there's some bleeding that is going on. So you have to be calm, composed. And you need to channelize your skill and your stress that is and your tension that is going on to control the bleeding or to control the complication or to handle that problem. If a surgeon starts screaming and loses his cool and starts abusing the staff around and all, then all those guys are also going to, the effort that they are putting in, that is not going to help. All these things, this commotion is not going to help them. So eventually the problem is not going to get solved. So you need to maintain calm and composure, channelize your stress and control the bleeding or whatever the scenario is, the complication has to be controlled.
But this sounds like a more person-to-person variable, calmness. As a personality, are you naturally calm or you have had to practice calmness in surgeries?
I was naturally calm somehow. I took
comes
it
across
from
like that.
Yeah. I took it from my father also and my grandfather. My grandfather was the coolest person that I knew. And
why do you say that?
Because I used to see him talking to the patients or the people in general. He had that sense of calm, that zen inside him, and the people, those who know him, will obviously vouch for it because you have that zen on your face. There's a calm that people notice when you talk to them, when there's a situation that is handled by him or her. So it comes to me naturally, I think. Even my dad, in any stressful situation, he always says that whenever you lose your cool, all your colleagues and the staff that is working with you, even they can't perform well. So I've been having that in at the back of my mind since the beginning. So I don't know, I naturally incorporated that calmness in me, and that helps a lot during surgery.
There was a third a good quality of a surgeon you mentioned, and I'm blanking at this moment. It was a good surgeon to the patient, a good surgeon to the colleague, and a good surgeon to the hospital. Did you say the facility?
No, the staff around you.
Achha.
That is what we just discussed.
Yeah.
So you need to be calm in those stressful situations.
Yeah.
So that is how the staff that is working with you, the sisters, the OT technicians, the ward boys, they, when you maintain your composure, they can perform to the fullest. So if I start abusing and losing my, I lose my cool and I start abusing them, I start shouting in the operation theater, they can't focus on their work. So when I maintain my composure, that is when the staff around me, they can work well. Even they are aware that there's some complication that is going on. The situation is stressful. But by shouting and by
raising the temperature,
it is not going to help the situation in any way. So a good surgeon to them, to the staff working with me or with any surgeon, is someone who maintains composure and they're calm during stressful situations.
Do you think India has a shortcoming in terms of skill, facilities, equipment of any kinds when it comes to healthcare, or is it on par with the best of the best in the world? And if it is different, how is it different? For the good or for the bad?
So now if you talk of Indian doctors, so we are actually supplying doctors to the entire world these days. So you see the doctors in US, you see the doctors in Europe, you'll see a lot of Indian doctors there. And people somehow, I don't know if it's true, but I've heard people saying that they prefer Indian doctors because they have a good vibe, say they are intelligent and whatnot. So definitely the doctors and the medical scenario in India, the doctors are definitely
top of the class.
They are top of the.
But are we losing a lot of doctors to other countries?
Maybe. The brain drain concept is always there, has always been here. So if you talk of rights and the security and all that doctors have, I don't know if it is good in these days. There are
we are currently undergoing some of the worst
scenarios,
human rights issues with the West Bengal hospital.
Yes, so it has been like that since ages. People they have been attacking the doctors, they have been abusing the doctors. So there has to be some law, to protect the doctors. You should protect the healers, like they say. So that is
actually, it should not require a law. This should just be common sense. I mean, why a doctor?
It should be a common sense, but common sense is not that common these days. That is what happens. So there are a lot of cases wherein doctors are beaten up, they are abused and whatnot. So that has to stop somewhere.
But you're saying skill-wise, we have some of the top people.
Definitely, skill-wise, we have the world-famous people. The doctor, the surgeons, Indian surgeons are called outside and they are asked to demonstrate a few techniques to the world. So definitely we have very good doctors, no doubt about it. And the doctors are very accessible in India, if you see. So in other countries, to get access to a specialist or a super specialist is very difficult.
Can take months at times.
So that is how having a good doctor that is accessible is a privilege that we as Indian people have, is what I think. Coming to the technology part, yes, we are gradually going to that level wherein we are at par with other countries. Yes, we have a few shortcomings, and I think in a few years we'll be able to reach those, overcome those shortcomings and have that state-of-the-art medical equipment in India also. We are already moving towards that. We have all the robotic equipments, the robotic surgeries, different systems. We have different scenarios or the different medical equipments that are launched in Western countries. Right on that, in that time period, those things are launched. Yes, are available in India also. So I think we are.
Do you get a sense that all these technologies? I come from to give you a caveat, I come from the medical device development world, and given that a lot of these companies will design these devices primarily for the US market or the European market, and now Chinese companies will design it for the Chinese market, and India being one of the larger importers of technology in the healthcare space. When you import these technologies into India, do you see a mismatch of any kind with how we use technology or our behavior around, like for example, for a really long time, we are resource constrained. So uh, taking good cognizance of the fact that we are resource constrained, there have been notable instances wherein disposables have been sterilized with all good intent and reused until it really breaks away. So the product was never designed like that. In your experience, what's the mismatch between designed in the world but not applicable to India?
So design wise, I think whatever is launched in the Western countries, we definitely get those same models here. But the time frame is a bit different maybe. After they launch it somewhere, after a few months, it is available in the Indian scenario. But the skill of the doctor that we have here, it is really beneficial to treat the patients with the equipment that we have. So it is not like we are far behind, maybe, but on the brink of having the best equipment made in India as well.
Achha.
So there are a few robotic systems that are made in India as well now.
Oh,
so
that's good to know.
We are going towards achieving that
made in India
and Make in India initiative, and definitely that will help a lot. The cost of the, like in cars, when those are made in India, the definitely cost is reduced. The same way we are expecting the robotic systems, they get made in India. Even the companies that are making those abroad should make it in India and assemble in India, and then we'll have reductions in the cost is what we expect. Let's hope for the best.
Those are some really good patriotic thoughts on your account. But often the genesis of a new innovation is an unmet need. So if I ask you to change your hat for a second and forget that you're a doctor, and this is my personal selfish ask of you, that if there are one or two unmet needs or from a medical device perspective in surgery that come to your head really well, like, oh, if I could do this surgery differently and I need a new tool, that would be great, or this tool really needs a big redesign, is that something that comes to the top of your head there?
See, right now, what we are in an Indian scenario, we have always been taught to work with whatever we have and give the best output possible. So we are not crybabies कि ये नहीं है तो ये नहीं हो सकता, वो नहीं है तो ये नहीं हो सकता. The jugaad has always been a part of our life since the beginning of times. So whatever we have in our hand and with the good skill and that scenario that we possess, I think we should be able to handle all situations, all major situations well with the equipment that we have here. So definitely if we have good equipment coming and it is inbound, definitely helpful. But whatever we have in this scenario, we make the best out of it. So, and there's medical tourism that is happening in India. So we are doing something right. Right?
It's probably for the skill. So you don't need to go back to the Western countries. There's one question that comes to my mind now at this point. You have achieved some of the highest skills as a minimally invasive surgeon. What are the unfulfilled ambitions going forward from here? What do you want to do next?
There's always, as a surgeon or as a doctor or in any field, you need to be acquiring knowledge and learning. When you stop learning, that is where your life stops. Some famous person has said. So you have to be updating yourself. There are regular conferences and meets that we have wherein we upgrade our skill, we update our knowledge. That keeps going on. So there is no stop to it. So I think the updation and the upgrading of knowledge has to happen at any walk in life. So even
more
if you
so
are
for the surgeon, I believe.
Yes.
Yeah.
So even if you are a very skillful surgeon, you have attained a certain height, even then you have to be learning something every day. So be it any skill or some modification that you can do in your surgery, which will be it will be better for the patient.
Correct.
So all those things you have to keep upgrading.
We really wish that India gets healthier. We are working towards that direction, but unfortunately, if somebody has an unfortunate illness, we hope you're going to make a lot of patients healthier, happier, and have a long, fruitful life. On that note, thanks so much for coming on 42 Talks. Your general seminar on minimally invasive surgery, cancer, and the angle of spirituality that you bring to the zen and the calm that I can feel when you're talking about surgeries going bad and you controlling them was really reassuring if I ever get into a surgery scenario myself. So thank you so much for coming on 42 Talks.
Yes, thank you so much for having me. It was fun talking to you, and I definitely I look forward to having this sort of conversation again sometime.
You're most welcome.